And now we're at a point where you have almost 80% of doctors who are employed. And some of them are young doctors, and maybe they've been employed since day one, right? They left their residency and moved right into employment. And their perceptions could be very different than a doctor that had practiced independently and had now trying to move into a corporate owned practice, and it, might be feeling that. But all in all, there is a very clear sense that their patient, the relationships with patients are being undermined. And I really urge you to look at that NORC study. It's fascinating. And now we're planning the follow-ups because we thought, oh, we should ask that. It's really fascinating about the impact on clinical care, the impact on physicians' own, like their experience of practicing. We found a really high percentage of physicians who plan to leave the practice of medicine early and maybe take a job before their ultimate retirement from work in a different setting, maybe as an administrator, maybe doing something totally different, because there's just this high level of burnout, high level of professional dissatisfaction. It's very concerning. And so, we use this comment letter to really lay out some recommendations that we think are really important to protect against the intrusion by corporations into what should be a physician's decisions. Physicians have a fiduciary responsibility to their patients, and corporate entities have a fiduciary responsibility to their shareholders. There is a fundamental difference there. And to ignore that and to think that that's not really going to impact the care that's delivered in our country is really Pollyannish.